Gentle. Good. Did you feel your ear there?
Huh?
Did you feel your ear?
Yeah. My ears crack sometimes. Also, when you were just adjusting, like behind here, I could feel all of the bubbles leaving like you could literally hear them internally, like all the fluid draining.
That's what just happened when I adjusted your occiput too. There was this big fluid gush.
Mm-hmm. Yeah, that's all. I told you, like, I have permanent fluid behind my ears that's just been there my entire life. And they're just like, my whole life they put me on Claritin. They're just like, oh, you have allergies. And then my most recent physician was like, you have lupus. And he's like, you have fluid behind your ears because you just have a lot of inflammation. He's just like, it's just a part of your life.
Well, I'm glad they figured that out.
I know. Thank God for that dude, because he was like, something's up. He's like, I just don't understand why you've seen this like family medicine doctor for like 18 years. And he's like, he didn't even do a blood test on you. He's like, he sent you to a specialist. And I was like, I didn't even realize he didn't do a blood test on me.
Yeah, so like a medical doctor can't do a blood test? Jesus.
He sent me to a blood test, and he's like, instantly found it. He's like, I don't know if this dude just didn't do his job. And I was like, I loved the doctor I had. He was just probably just thought it was allergies my whole life. He's like, oh, this kid's probably just complaining.
Well, it also too, my feeling is that this lupus diagnosis with only the one marker, the second, seems to show up a lot in certain medical situations.
Yeah, that was kind of how it was, because he noticed, he actually did a normal panel, and he realized, he's like, every time I've done your blood, or he's like, I've seen your blood done, he's like, you have a high white blood count. He's like, that's so odd, and no one's ever pointed that out, and that's what he discovered. He's like, it's just, you're so inflamed all the time, and it's like, it's not even like inflamed all the time, it's just like, I am sensitive, so you scratch me and I get red and stuff. It's like my inflammation response.
Yeah, that's what an autoimmune is.
Mm-hmm.
Your body fights itself. Okay, we're gonna do some digestive work here. Tender? A little bit? Mm-hmm. Let me see this one here. That one tender? Mm-mm. Okay, put this hand here under, oh, I like that. All right, I'm gonna palpate your abdomen, okay? Here, we're gonna start up here underneath the rib cage on the right. Very gentle. Very gentle here. This is the digestive valve called the ileocecal valve in between the large and the small intestine. Okay, nice deep belly breaths. Good, and out. Good, deep belly breath, and out. Sensitive?
Mm-hmm.
Ticklish or tender?
Like ticklish.
Okay. Is it still tender in there?
Mm-mm.
It's better, right?
Mm-hmm.
All right, I'm going to contact your sternum here, okay? You know, a lot of times with these autoimmune diagnoses, really your digestive system is such an integral part because you're just eating food all the time. And then if you have any kind of leaky gut, which I'm sure you've heard of at this point, well then yeah, of course your immune system is going to be activated all the time. Of course you're constantly going to have white blood cells high. The Rh factor is a little bit different story. You definitely need to activate that somehow. But you know, I've been reading a lot lately about people who have sensitive gut issues, and they go on European vacations, and all of a sudden they can eat gluten, and they're fine.
Yeah.
Because it's not really gluten.
Mm-mm.
It's the glyphosate that they put on the gluten.
Also, just the way things are milled in the United States is different. They mill things with like bones and stuff, like flour and sugar.
Mm-hmm.
Which in other countries they don't do that no more.
Mm-hmm. Okay, bend your knees again so that your feet are flat. All right, squeeze my fist again. Hard as you can. Okay, relax. It's supposed to pop the pubic bone, but I don't know why it's not doing it.
I don't know.
Here, put your legs back down again.
Like I said, I have weird knees. Like really weird
Oh, it's not a
knees.
knee thing, it's a pubic bone thing.
Oh.
Here, hold this so it's strong, but like, yeah, don't let me push that way. Good, relax. Relax. All right, so here's what we're gonna do this time. I'm gonna do a cranial manipulation inside your jaw, okay?
Okay.
So you're gonna, I'm gonna contact your teeth.
Okay.
Okay, so first smile. Okay, now relax your smile. No, relax your face. No, don't close your mouth. Just let it go. Yeah, there you go. All right, now say ah. Your lips get super chapped, huh? You drink enough water?
I do. I just don't absorb it. I've been going in for IV therapy.
Okay, put your arm back up again.
This one?
Right arm, yep. Okay, make it strong, don't let me push. Okay, relax. This is a breathing sound meditation. Sound is a powerful meditative tool because it keeps you present in the moment, just like your breath. You're always breathing in the now. Keeps you out of the future, out of the past, the alternative timelines, allowing you to collapse particulate reality, collapse the waveform of the atomic world into particulate reality. It's pretty heavy. Mm-hmm. But the math and the science is all there. And they've also been saying it for thousands of years, so it's interesting.
As someone who has read enough FBI and criminal science documentation, there's a lot of spirituality that we should be looking into. And also my parents are Navy. So it's like my dad he's a criminal investigator. He's like, there's so much stuff that we're just not allowed to discuss.
Cool. But they released a lot in the CIA.
Oh, yeah.
Astral projection, you know.
Yes, exactly those things.
Psychic warfare, yeah.
I mean, the Harvard experiments that they used to do and stuff.
Mm-hmm. They call it manifest your reality, but I like to say that you actualize your intentions. Mm-hmm. The universe likes action.
I always think about the phrase that Michael Jackson said. He's like, if I don't get it done now, Prince is going to do it. God's going to give it to Prince. Like, the idea to Prince. And I was like, I always thought about my steps like that. It's like, you got to get to it before, like, you're regretting it or someone else has the idea.
Speed of implementation is very important. We're all hooked into the same matrix of thoughts. Yeah. So when you get them, they're not really yours. Mm-mm. So I'm going to use the gong. Okay. I want you to focus on your breath. Try to stay present with the sensation of breathing. Feel the expansion as you breathe in, the release as you breathe out. If and when your mind wanders from the breath in the present moment, you can let the sound, either the bowl or this sound right here, to remind you to come back to the present moment.